Hello, everyone. My name is Damian Cabrera. I am the program manager for the Treatment Division, and I am super excited for the webinar that we have prepared for you all for today. Essentially, what we're going to be talking about today is about community representation to make sure that social media campaigns that are targeted around prevention, treatment, and stigma are grounded in the community so that the message actually reach those that we need to reach. And this conversation is going to be facilitated by the CDC and also two of our program members that are going to be part of the community discussion part of this webinar. And just to give you a little bit of background on how this webinar came to be, NMAC recently received a grant from the CDC to support each other into promoting the Let's Stop HIV Together campaign that the CDC folks are going to talk about a little bit more. But this campaign is essentially focused on HIV prevention, treatment, and stigma. And people can even look for places around them based on their zip code where they can access HIV services. And if they're now, if you can put the link for people to access the campaign, that would be great. And now I would like to introduce the folks from the CDC that are going to be giving us more details about the campaign. We have Darlene. She's our project officer. She's a project officer for the CDC's National Partnership Team, and she currently serves as our project officer at NMAC and manages four additional PAC recipients. And with Darlene, there's Trang Nguyen, and she is a health communication specialist and community social and part of the community social marketing team for the CDC. And for the community discussion, we have Teresa Sullivan. Teresa is part of the HIV 50 plus strong and healthy program from NMAC, and her areas of expertise is in the intersection of HIV and incarceration of women's health. And she's also the director of HIV prevention and education for Philadelphia Fight. And she also trains other people living with HIV around treatment as prevention so that they can, engage in the conversation and train others. And we also have Dwight. Dwight is a fellow for the NMAX Gay Men of Color Fellowship, and he also proudly serves as the community coordinator of outreach, linkage, and engagement for the Gay Men Health Collaborative in Fairfax. He is most passionate about issues impacting Black queer communities and providing educational training around sexual liberation for Black gay men. And this is a brief introduction. I want to jump in real quick to the conversation because I know we have a couple of things to cover. Thank you, everyone, to the panelists, and thank you for everyone that is attending this webinar. If you have any questions, please put them in the Q&A box. And then our Darnell, who's the coordinator, the communications coordinator for NMAC, he's behind the scenes making this happen. He will read your questions. And if there, Frank and Darlene, if you can turn on your cameras, and I will turn off mine and share my screen.
Hi,
Can you
everyone.
see the first slide?
Yes, I can see the first slide.
Awesome. Great. Take it away.
Okay. Hi, everyone. Glad you guys are taking time to join us. We're very excited to share with you kind of what we do. So what I'll be doing is just providing a little background regarding the PAC program and each of our roles. The project officers who support PAC team, also known as NPT. The goal of NPT, of the National Partnership Team, is to create a network of partners. I'm sorry, go to the next slide. The goal of NPT is to create a network of partners that work collaboratively to educate people about HIV, reduce new HIV infections, and eliminate stigma. The team also does this through a coordinated approach across public and private sectors. We develop partnerships and provide materials and resources for partners to support EHE, or in the HIV epidemic. NPT activities include partners, supporting partners and grantees like you guys, extending the presence of the Let's Stop HIV Together campaign materials and messages at conferences and events, recruiting, engaging, and coordinating partners within CDC's Prevention Communications branch and across the division, and gathering non-systematic feedback from partners on together. And this is really essential because you guys are the boots on the ground. The feedback that you guys provide us is essential. So when you're getting our materials and you're getting to see them and you think this is wonderful, let us know. Or if you think this is so wonderful, let us know that too, because you all have a unique perspective and you can see things that we can't. You know how they work and you know how they are, how engaging or not engaging they are with the community. So that's what we want. It's no point in doing it if it's not going to, result in yield the results that we want. Next slide. So a data found that more than 50% of the new HIV diagnoses occurred in only 48 counties, Washington, D.C., and San Juan, Puerto Rico. The analysis also found that 7 states had a substantial rural burden. To achieve maximum impact, ending the HIV epidemic began by infusing these 57 geographic focus areas with additional resources, technology, and expertise to expand HIV prevention and treatment activities. So EHE prioritizes populations at greatest risk in these communities, including African Americans and Hispanic Latinos. Clearly, this is not something that we can accomplish without partnering with organizations like NMAC and their influencers who have a voice within the most that you are essential to our success. Okay, and the next slide. Okay, so I've talked about, kind of what we do, talked about EHE, and I'm just going to talk a little. And again, I keep saying this, but for me, it's so essential and it's important that you guys know we can only be effective if the messaging gets to those who need it most, which is why NMAC is so committed to engage for social media posts and virtual events. This is it happens, engaging you guys so that you can reach those communities that you know and love and live in, that they're your communities and they're your people and they're our people, but you have that connection to them that we may not have. So also leveraging awareness days, HIV focus and beyond. And I say and beyond because, sometimes there's something else. It may not be a HIV. I don't know what's going on. Can you guys hear me? Somebody just say yes or something if y'all can hear me, because it seems like my computer is talking to me. It's okay? Okay, I'll keep going then. Okay, using a variety of communication channels. Oh, I'm sorry, what I was talking about was leverage. Activities that might make a difference. Using a variety of communication channels like websites, blogs, webinars, newsletters, etc. Conducting media buys is really essential. And finally, using a variety of social media platforms like Twitter, Instagram, Facebook, YouTube, TikTok, LinkedIn, Snapchat, and whatever the next new thing is going to be that will be out. And you guys cover it well, because you might find somebody like me on Facebook, but you might find my son on Snapchat or TikTok, and you guys cover all of that. So that basically wraps up my portion of the presentation. But I want to thank you guys for standing in the gap and making these connections so that your communities can get this critical information and materials. And so now, after that, I will pass it on to Trang, my colleague, who will talk about the Let's Stop HIV Together program and what that has to offer for you guys.
Hi all, sorry, I couldn't get myself off mute. I'm gonna not have my camera on because I've been going in and Hi, can you hear me? It keeps muting me. Next slide, please. You can go to the next one too. So I'm going to be going through a number of slides here that has our resources with videos, but I'm going to, I think the slides will be sent out afterwards, just the interest of time. I'll go through them, and if we have time at the end or during our Q&A sessions, I can go back and we can replay some of these videos, but I'll play the next slide, please. Oops, you might have to click it one more time. The audio isn't playing. So some Snapchats from some of our videos. Sorry, the audio didn't go there, but hopefully we can replay it later. So our priority populations really are in line with our division of HIV prevention, as well as our national HIV and AIDS strategy. And this is obviously not a comprehensive list. We also go into, as we know, the intersectionalities of all our priority populations and creating and providing
Frank, I don't know if it is only for me, but you keep muting yourself, but I don't know if it's only for me.
Yeah, it keeps automatically muting me, so I have to then unclick it, which doesn't always happen. So I see a green light, so I'm gonna keep going while we have our time together. My apologies all. So across our Together materials,
Sorry, Trang, I cannot hear you. Darnell, is there anything that we could do in the system, in the platform,
Yeah,
that might help us?
I keep unmuting her, but it's for some strange reason hers keep muting.
Okay. Okay, let's try to move forward. Sorry, folks. These things happen when you go live.
Next slide, please. So some of defining features of our Together campaign is there is a comprehensive look and feel across our campaign topic areas, which are HIV prevention, HIV testing, HIV treatment, and stigma reduction. We also have examples that we've shown throughout this presentation that I'll speaking a little bit more about our journey video. So our campaign participants are real people sharing their real lived experiences and telling what we hope to do as having them in our campaign is really to bring their stories to the forefront. We also create our Spanish content is also developed in Spanish and what we call through transcreation of our materials, which is really which leverages cultural knowledge to create material.
Trang, I think it may be your connection.
To tell the full story. I'm just going to continue to, whenever I see the green light, I'm going to keep talking. So I hope you guys can stay with me. I'm so sorry. And then versus just a direct translation into our Spanish. We also have very user-friendly features on our Together sites that are meant to be shareable, downloadable, and adaptable. Next slide, please. So of course, our materials, our campaign are very much science-based. We do a lot of formative research, concept testing, message testing, implementation, evaluation, and refinement. So this definitely is a space where NMAC and partners and community members really help us kind of be part of that process. We have a comprehensive HIV portfolio, spans, like I said, the continuum of HIV care, testing, prevention. We have user-friendly digital resources and are very intentional in including diverse and inclusive representation in our portfolio across our topics. Next slide. Like I mentioned earlier, culturally informed Spanish content. Our materials are also tailorable and cost efficient in terms, like I mentioned, we do a lot of the back end kind of formative research, design. Next slide.
Trang. Trang.
That can speak to, sorry, it just goes off on its own. So I'm just going to continue to talk. And adaptable and tailor. Create messages that make sense to your specific audience. Next slide. So we've talked about this. Our focus areas are stigma reduction, inclusion care, testing, prevention, treatment.
I'm sorry, Trunk. I cannot hear you. Could you try to unmute yourself manually?
Trey. Damian, is it on your side? Can you hear?
I can hear you, but I cannot hear Frank. I think she might be having problem with
Are you all hearing me now?
Yes.
yes.
Would it help for her to call in maybe and for the sound? I don't know if that's feasible or not. I'm just trying to think of what might work.
Yes, Trey. You
Yes, I
think?
was just texting. Darn.
Yeah, we keep losing you. I think that also what we can do, I would really like for the community to see the resources that are available from the Together campaign. So if you folks agree, I think that we can jump into the discussion and then come back to the resources once Trang calls in. Sounds good?
Yeah.
Perfect. I am going to unshare my screen. And if, yes, Teresa and Dwight, if you can turn on your cameras, and Darlene, you can keep your camera on also. We would like to have a conversation. And for people that are in the audience, sorry about the technical difficulties. These things happen when you go live. So, but I wanted to ask Dwight. After what, by the way, before we start with the conversation, for me, one of the things that I really like about this campaign, and that I feel really excited for NMAC to be a PAC member, is that first I can see a lot of people of color in it, and that we can also choose the communities that are that are our strengths. You know, at NMAG, at least on my division, our strengths are gay men of color and also people who are living with HIV who are 50 plus. That's why we have Dwight and Teresa here. And I do realize the importance of uh, for the community to see themselves reflected on the not only on the but also on the visuals of the campaign, so it's relatable, so I can say, hey, that message is for me, I see myself there. And Dwight, as one of the tasks that you and the rest of the fellows had as part of the Gaming of Color Fellowship, was essentially to come up with a social media campaign that was based on your voices and the messages that you and your teammates thought that the community needed to hear in the language that the community needed to hear. So from your perspective, I know that you are very social media savvy also. So from your perspective, what can you add in terms of how we can tweak, or what things should we keep in mind to make social media campaigns grounded on the community?
Yes, thank you. First of all, I agree completely that the aesthetically pleasing images of Black and Brown queer folks represented in the CDC materials is so important, because that's so foundational to what makes successful social media campaigns work, which is one of the things I cannot understand about systemic racism, especially in multimedia, excluding the beauty, the fashion that is the Black, brown, queer experience. We are so like dope, quite frankly, for these sort of opportunities. Just looking at the material, the glistening skin, the vibrant colors, our skin against those color palettes. And so to exclude us from the multimedia promotional items and things like that, especially when these are the communities that we're targeting, it just boggles my mind. But to your question, yes, having aesthetically pleasing images and also accompanying those images with a real sincere intentionality behind what you're trying to do. It's one thing to say that you want to be an HIV influencer to get numbers or money or clout or whatever your secret agenda is, but to have real passion, to have real consideration for the folks that you're trying to reach. We can always see through false intentions, negative intentions, even if we're behind the screen. And so what we would like to see through social media marketing is a real sincere voice, a real sincere presence. And I think what also helps is sharing a bit of your own story in your messages as well through social media, because this is the opportunity for you to leverage your personal brand to speak to messages and things that you know, or to express yourself around these issues, but also to bring that sort of originality with the passion. And then also knowledge. You got to know what you're talking about in your messages. So those are great insights and information for people to accompany those aesthetically pleasing images that I was mentioning before. And I think with all of those in combination, you have a successful campaign, or you have a successful image or marketing strategy.
I absolutely agree. And to your point about knowledge, I think that the community needs peers that are well trained, that know the information, and that they can identify folks through social media that I may, I have questions about PrEP, I have questions about treatment. Maybe I can go to this person and ask questions. And I think it's so important that we leverage community members, and that we provide this education for the community, so that the community can also, go and pass along this information in their own voice, in their own language. Um, and Teresa, I see that you agree with a couple of things that we are saying. But before I want to hear your thoughts. But one of the things that I would like to say beforehand is that, at least in my experience working at MMAC and working with such a fierce group of advocates who are 50 plus and over, is that there's not much information, there's not much visuals that represent this community. And one of the things that I appreciate about this partnership with the CDC is that we have this open doors in terms of the things that we can do to support each other. And having this conversation is like, yes, there's a need, and then we are both, seeking how to fill in those gaps. Is there anything you would like to add? What are your thoughts around campaigns for 50 plus folks?
Yeah, thank you so much. And yes, Dwight, I totally agree with a lot of that that you just said, that we are appreciating seeing ourselves in these campaigns. And one of the things that we tend to get tunnel vision about is that social media is just about being on a platform that's on the internet. And our communities of Black and Brown people who live with HIV, some of those digital divides of real things that happen, they can't have access to computers and smartphones. So a lot of media campaigns need to have it on the ground in their communities, when they're standing at the bus, catching the bus, when they're picking up their children from school, when they're going to the school, underground, on the subway, things like that. It has to be in our face, right? Especially a lot of cis women who are Black living with HIV. We're seeing an uptick for new infections of HIV amongst Black cis women. 6 out of 10 women are now acquiring HIV, and they are 50 plus. They are over 50, right? And what we're seeing a lot of times also, because your campaign talks about stigma, right? And that's a great place to start, because stigma is one of the things that still fuels this epidemic right to this day. And we're talking 40 years later, right? Is that training providers to have those open dialogues with women about, PrEP if they're not living with HIV. Talking about it with them, about how their partners can access it. As an educator, I see a lot of women have not enough information to have those conversations with their partners who are living with HIV, and their partners are not living with HIV, right? And a lot of stigma around, why are you asking for that? You over a certain age. The reality is that we're still having sex, right? We're living longer, we're more healthier, we are sex positive, right? And that we deserve to have those things in our lives, but we also deserve to have tools in our tool chest that we can use for treatment and prevention if we're not living with HIV. And that's PrEP. I was very disheartened when I seen that the ring was not coming to the United States, right? And I was in the Margarita Breakfast Club. We were having a conversation about that and how we felt like this needs to happen here in the United States. I know it's happening in undeveloped countries, and that's great. But what about here? What about home? Right? We have not, we have done better in the years, but we can do much more better, like reducing community viral load in our Black and brown communities by hitting the ground, have boots on the ground, right? And things right in the neighborhood, right? And not so much saying, it's not wrong with like social media. That's what the years we're living in. Everything, especially since COVID, with Zoom, or some social media page or Twitter or something like that. But for people over 50, we might not be on those pages, right? The average, statistics around people over 50, we might be Facebook, and that's about it. Right? We're not using chat, whatever it's called, and like WhatsApp, none of those things, right? I got an Instagram page, but I barely be on there, right? So I need to see things in my neighborhood when I walk out into my community, right? And I need to say those campaigns need to look like me, right? They need to look like older women, right? 50 plus, talking about treatment as for HIV and PrEP as an option if they desire to engage, right? And how they can do that. I like to see more commercials on TV of older people talking about both treatment as prevention, right? PrEP is for people not living with HIV, and it's not just for same gender loving couples. It's for heterosexual women too, right? And a lot of heterosexual women don't know that. They tend to think, or hear certain things, and they take it at face value that, well, that's not for me, right? So I'm not going to engage. So we need to get better at a robust community education on the ground, right? As Damian said, we need some peer educators on the ground talking about, they trained up, of course, right? Because we'll make sure that the message that gets out there is the correct message, right? We don't want to give people no false information and it comes back to slap us in the face, right? So we just want to make sure that all those messages are very inclusive of not just, younger people, same loving gender couples, but cis Black women as well, as our uptick is happening right now for 50 plus women right now. So that's what I would like to see.
And I think you have covered so many layers about representation, about also making efforts to meet the community where they are. And that sometimes means leaving social media and, making sure that these messages, cross the screen and are present in I don't know, in churches, in centers that the community meet. And also one of the things that I have heard on and on working with the 50 plus folks is that how, for example, the younger guys, the younger folks are maybe hypersexualized in campaigns, but then on the other side, we have the absolute uh, like sexuality doesn't exist for people who are 50 plus and over, and that, you know, we know that it poses an additional barrier for doctors to screen, and
Yeah.
also for 50 plus folks to feel comfortable having these conversations. Darlene, I would like to hear your thoughts from the perspective of the CDC. I know you have been working with this campaign for some time. If you want to jump in and add your thoughts, I know you said you mentioned something about when we were talking about Facebook. Anything you'd like to add?
We can't hear you.
We can hear you. You're muted. Can you hear us?
I think we lost her.
Can you hear me now?
Yes, we can.
Okay. Okay, so this is so good. This is so exciting just to hear, Teresa, the things that you brought up and everything, because
Can't hear you.
No, we lost you again, Darlene. Sorry.
okay, I'm trying to get the 60 plus, the 50 plus community, you know, the things that we need beyond social media. That those are the kinds of things that we really want to know and we want to hear, and we want to make sure that we're responding to those. And the stigma is so great. And being an African American woman, and you know, the places where you think that they should be open, like churches, that's where the stigma is the worst. And so you know, thinking about how we can attack those things and how we can, you know, because it only hurts us, you know.
We lost you. We can hear you.
You all hear me now?
Yes.
Okay, I was just saying that, you know, one of the scriptures says, "My people perish for a lack of knowledge," and that's we don't want to be in that category. And so, and the other thing that I was just thinking, you know, so it would be funny. Black don't crack. So I'm getting ready to celebrate my 60th birthday this weekend, and so maybe we might need to let people know, you know, that we're 50 plus, you know, because some of us may not look like that. At least we like to think that we don't, you know. So so that might be something else, because we may be looking at people who are 50 plus and don't even realize it. Just something to think about, you know. But yeah, as much.
We lost you again, Darlene.
Darlene.
As much as you guys can give me feedback, I love it. I love to, because this is.
Watch again.
Oh, yeah. We keep losing you, Darlene.
Losing you. There you go. Hey, Darlene,
Okay.
I just turned 60 in January.
Yep, making it look good.
And another thing that I would like to add is that, going back to education, is that sometimes understanding treatment, sometimes understanding prevention can be so difficult. You know, sometimes we take it for granted. Us that we work on the HIV field, like this is easy because we are in contact with this type of information every day. But for some people, this might be really complex, and that might actually be one of the barriers. And I think at least one of the perspectives that we have tried to do in the past is not necessarily leaving behind the clinical discourse, but focusing on pleasure, focusing on sexual communication, and also focusing on how treatment and how being on PrEP makes us feel. You know, does it make us feel happier? Does it make us feel empowered, like we own our bodies, like we can take our decisions for our own bodies? And then that might also be another way to overcome the barriers that the community right now is facing, because we know there's a lot of stigma around HIV, but we also know that there's a lot of stigma around sexuality in itself, right? Being on PrEP, some people might think you're promiscuous, like if that is a problem, right? And then yeah, there are so many barriers that I think that when we go back to social media campaigns, the language, the visuals, everything has to reflect those type of needs to see how we can feel how we can fill in those gaps. Dwight,
Can I
anything you'd like to add? Yes, go
No,
ahead.
I just want to just add a thing. The reality is the fact that, we are sex positive people past 50, right? And I was, and this is just quickly, asking another colleague who lives in Baton Rouge, that what was the #1 cause of Black women acquiring HIV? And she said marriage, right? And I was really shocked because of the fact that married women don't think that they are at risk because they're married, right? So getting to that population, talking about PrEP as an option for such Black women, especially in the southern states. And I just want to put that out there.
Yes, for me, the sex positive component of HIV prevention work is so critical. And I think it is very reflective of this present moment in time. This is a very important moment in history where the walls are beginning to crumble in many ways and many institutions around us, and including sex. And one of the most important things about social media is that it is helping us evolve with the times. And so in order to be on social media, in order to use social media, in order to know what to do on social media, you have to be able to be aware of trends. You have to be able to sense the trends. You have to be able to keep up with them, and you have to evolve with the times. And so right now, this is a perfect moment to capture the essence of what it means to be sex positive. That's decolonizing our bodies. That's opening up about what we do behind these quote unquote closed doors and closets and all these other dark places that they try to put this very beautiful thing of our humanity, which we know to be our sexuality. It's so important to our health. It's so important to our identities, and it is so important to HIV prevention work. If we ever hope to end the epidemic, if we ever hope to become a more progressive, positive society, we have to acknowledge the sexual liberation, sex positivity piece of it, which I think is so important.
Yeah, and as you were mentioning, when you're in social media, you have to be very conscious about the trends and the conversations and all the I don't know, like the dances on TikTok or whatever. But then and I think this is a good opportunity for like intergenerational conversations, right? Because for younger generations, TikTok, Instagram can be like a natural skill of knowing how to use them, but that might not be necessarily the experience of someone who is 60, who is 70. And I think that there's a lot of opportunity for having these conversations, and maybe younger generations being in contact with those who are 50 plus and over, and kind of training on social media, and passing along that information, because I think that's something that we just assume that everyone knows, but
Right.
that's not necessarily the case.
That's right, Damien. What I love about NMAC is that at our conference, there was a separate room that you could go to learn about social media, because NMAC realized that everyone's not savvy in social media. Everyone doesn't know about Instagram and TikTok and WhatsApp, the app, whatever it's called, right? So everyone doesn't know that, and you can see that by me saying I don't know all those things that's out there. Making sure that we're real inclusive of like the generational gap that we know that's in our face right now as we're moving forward to end an epidemic and a lifetime of people living with HIV. I need to say that, right? And getting us like more savvy, trained up, and on the social media platforms. We don't have to be trying to be on those platforms as experts, but we need to be able to access them to get information that's going to benefit our health, right? Especially when we're talking about HIV and treatment as prevention, right? And being real inclusive of like 50+ people, and getting people trained up. So that's another educational piece that we need to include, right? How do we educate this, generation that's 50+, right, about how to access all these things that's on social media platforms that they may not see in their neighborhoods, right? So that's another component that we need to look at. I know funding comes with everything. As a director of program, I'm aware, right? But it's a good thing to do if we're going to ever, like Dwayne said, in this epidemic. And again, in a lifetime of people living with HIV, because I want to see it, right?
Yeah, and Dwight, I know that you have provided trainings for the 50+, and I know that in the work that you currently do, you have probably encountered barriers on accessing social media across generations. Are there any, from your expertise in social media, are there any recommendations that you could provide to organizations that are making efforts to reach these communities?
Yes, social media in its own right needs to be destigmatized. And I think when we talk about stigma, for me, the way I define it is just irrational fear. It's just fear of what you don't know. And it can be a scary thing because when you look at the mass media's depiction of social media is data leaks and the misusing and representing information. But the reality is that it's just always been a way of unifying the world, which is also scary because we can't be in more than one place at once. And so when you think about your information, photos, pictures, all that good stuff being in Europe or somewhere else, then that can be a scary thing. And you might not necessarily want to be from a small town in Ohio and connected to somebody in California or around the globe. But for me, it's important to consider the power that you can have with unifying folks on that large of a scale. I mean, and there's also power in unifying folks in your own community of people that you know in real life. And that can be a powerful thing. And so, yeah, I think the main barrier is just fear of not knowing how to use the technology. Because everything moves so fast, which is another barrier. As soon as you learn how to use one iteration of Instagram, they come out with a completely different skin for it. And then you can be like blown into the wind with all the changes that they come out with. So just again, staying up with trends and keeping up with the updates. I would also say that it's important to lost my train of thought. But yeah, I think those are the key points is just to not be afraid to do your own investigation. And I think earlier I was speaking to passion. I think allowing your passion to fuel your desire to learn more about what's going on with social media. And I think that's the biggest way to overcome those barriers of being scared or not having enough information. Is just the fuel to go out and get that information for yourself.
I agree completely. And what I really like about it, what you mentioned is adding the personal side. You know that the people can feel that they're that the message is real. That you are talking like the person that they're listening is a real person behind the profile. I think it makes it so relatable, and I don't know if people can engage more and you can make sure that the message gets across. So thank you for that. Darnell, do we have any questions from the audience?
Not as of now, but I think they know that you guys are going to ask questions, so they're probably coming through now.
Okay, awesome. For the attendees, please If you have any questions for the CDC folks, for any of the community members, or for me, please put them on the chat, and then Darnell will read them out loud. And I realized that there's a link that Darnell posted. One of the links is for where you can access the CDC resources that Trang and Darlene were discussing, and also we are currently recruiting new members for the Gay Men of Color Fellowship. To give you a very brief background before we continue with the conversation, the Gay Men of Color Fellowship gathers a group of folks, and they are tasked with developing their own social media campaign. We provide the social media marketing training, the biomedical prevention basics, and then we also provide the graphic design. So we use essentially your feedback, your voice, and then we transform it into a design that you can then share with your community. The deadline for the submissions for the applications is March 2nd. So make sure you apply.
I wanted to add, as someone that's gone through the Gay Men of Color Fellowship, that it was a very enriching experience for me as someone that's currently working on developing my own social media platforms. And I was able to work in a cohort of other HIV influencers that are also sort of in the same boat of leveraging social media for their messages. And it was really cool. We were all from different areas around the United States, just being able to keep steady communication. And now they're some of my best friends, which is crazy to think because they're each in their own right powerhouses, receiving awards and facilitating events and things like that. And so just to have them now in my network is like so crazy. But we were a little strapped for time because we were working really diligently trying to put together some materials for our campaign. And so when we got down to the last post that we were required to do, we ended up using one of the CDC's materials to fill in our gap. And I think that that just speaks to how beneficial these materials can be for your own social media campaigns and whatever you're trying to do for social media. They just worked so well. We were able to use some of their information for prep, and we found images that were reflective of our target audience, which was Black, gay, bi, same gender loving men. And it was just really easy to access the materials, download them, and then disperse the materials out. So I thought that that was really, really dope.
I'm sure Darlene might want to jump in, but for me it makes me really happy to hear that, because one of the main goals of the fellowship is to actually expand the fellows network. And that's why they put into groups so that they can share their knowledge, their experiences from their context. So I'm very happy, very happy to hear that. Darlene, would you like to jump in? We cannot hear you. Maybe. No, we cannot hear you yet. Nope, not yet.
Can you hear me now?
Yes.
I feel like a commercial. So a couple of things I just wanted to say was I am very glad to hear that, Dwight, that there was.
Sorry, Darlene, we lost you. Yeah, I see that you're trying to unmute and then the system, I don't know. Try now.
Can you hear me now?
Yes, we can hear you.
Okay. Ooh.
If it is your connection, try turning off your camera. Maybe that helps.
Okay, let's see. Okay, I'm trying to turn it off. You guys can hear me actually now, though, can't you? Can you hear me now? still?
Yes, yes, we
Okay.
can hear you.
So I was just going to say, Dwight, I'm really glad to hear that the material was easy to access and you saw what you needed, and that's our goal. But I also wanted to say, you know, it's very exciting as a 50-pluser to know that NMAC is doing training and those kinds of things. And I'm also thinking about, you know, with COVID and how we've gotten so used to Zooms and all of those things, maybe that's a good starting point for 50-plusers, because that's something that we kind of have gotten used to, you know. And so just trying to think of different ways and things that aren't too scary for us, because, you know, we want to know, but sometimes it's you don't want to look like the one who doesn't know, you know. So you're just like, oh, I think I'll just pass on that. So those things are, but I just said that because for me, you know, I'm like the last one to get on the meetings.
We lost you again.
Sorry, Darlene, we lost you again.
Can you hear me now?
Yes.
Okay, and that.
No, we lost you again.
And we have questions, so I guess we'll just go with the question. So our first question, there hasn't been a focus on accessibility for local health departments. Local health departments do not have the expertise or the time to create social media campaigns. What is the CDC going to do to create more accessibility to local health departments?
I think, darling, that's a question for you.
Yeah.
I think it's already been answered.
Okay, yes. So we actually, the partnership team works directly with health departments. If there's
Darlene, could you
reduced,
try turning off your camera? Maybe that helps. And sorry that people won't be able to see you, but maybe that helps your connection. Can you hear us?
They type no.
Yes, maybe it's probably the connection. I think that we have only 3 minutes left. I would like to hear any final thoughts from Teresa and Dwight. And please don't hesitate to for the attendees, don't hesitate to send us your questions. Sorry that we are having technical difficulties, but we can communicate with you via email. And we are also going to share the slides to everyone that registered. So Teresa, any final thoughts?
Yes, thank you. So I'm loving what I'm seeing from the CDC in our partnership with NMAC. And the materials they have are usable, and they are teachable materials that I plan on using in the education department that I'm a director of. So I think those are tools that people need to like incorporate in their like local organizations. If they are a health service organization, using those kind of tools and getting it out into the community, right? And because nothing's better than peer-to-peer teaching, right? And making sure that people have the tools and knowledge they know, because if we're just assuming that people have this knowledge and they don't, right? And then people fall out of care, right? So we don't want to have that happen. And I'm excited about the connection of the generation of social media and the work that's coming from the White and y'all team, because it needs to happen, right? And I think we're headed in the right direction. And we just keep pushing that envelope, we'll get to where we need to get to end this epidemic in the lifetime of people living with HIV. So thank you.
Thank you. Dwight?
Yes, I'm so honored just to be able to speak with everyone and share a bit of my insights. As it's been said, if you have any questions, please feel free to follow up with us. I'm on the socials, so Facebook, LinkedIn, and I'd be happy to assist as I can if there's any other questions that we didn't get to for technical reasons.
Can you share your socials?
Oh yeah, it's just my name on Facebook and LinkedIn, Dwight Vinson.
Great. Darlene, any last words if you can? we cannot hear you.
We can hear you.
Okay, yeah, real quick.
Sorry, Darlene, we keep losing you.
We do have relationships and we work directly with health departments, and any questions that you have, please feel free to reach out to me or to us, and we'll get back with you. We'll get answers for you.
Awesome. Thank you, everyone. Thank you for joining us. Thank you, Teresa. Thank you, Dwight. Thank you, Trang and Darlene. This has been a really amazing and insightful conversation, and I hope we keep continue this collaboration and, you know, pushing things forward for our community. So thank you, everyone.
You're
And for
welcome.
the attendees, please make sure that you send us your questions and remember to fill in the evaluation. Thank you, everyone.
Thank you. Bye.
Bye. Bye.